Hi, it's Patrick Hutzel from IntensiveCareHotline.com with another quick tip for families in intensive care. Now, currently we're working with a number of clients who have their loved ones in ICU, and the ICU wants to do a tracheostomy and they want to send them on to LTAC or long-term acute care. That's for clients in the United States. I should stress that that's only for clients in the United States. So what we're finding is that ICUs are trying to sell a quote-unquote one-size-fits-all approach, that when somebody is failing one attempt of weaning off the ventilator and the breathing tube, they're quick in saying the patient needs a tracheostomy and then they need to go on to LTAC, rather than trying a second, a third, or even a fourth time to get those patients off the ventilator in the first place. Now, the trajectory of a patient with a tracheostomy is very different compared to a patient that can be weaned off the ventilator and the breathing tube in ICU, because a tracheostomy often implies long-term ventilation in an institution like LTAC or long-term acute care. The outlook of a patient having the breathing tube removed and being extubated and going onto a hospital ward is very different, and the rehabilitation is shortened by often many weeks or many months. So don't buy into the one-size-fits-all approach that if a patient fails extubation once, that they need to have a tracheostomy. They need to try twice, 3 times, maybe even 4 times in order to avoid a tracheostomy and avoid LTAC or long-term acute care. That's my tip for today. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll talk to you in a few days.